Are you serious about your health and fitness, but overwhelmed by the conflicting information and BS all over social media? Welcome to Fit Facts. Brought to you by Brandon Pascual and Gabe Erno. With a combined 10 years of training experience, this physical therapist and personal trainer duo bring you the most up-to-date and applicable fitness and lifestyle tips based on the most cutting-edge research, bridged with field experience of what actually works and is sustainable for the long term. Enjoy. I love Altoids. They're so good. But for some reason, whenever I eat an Altoid, I chew it immediately. So then I put the second one in, and I tell myself this time I'm gonna suck on it. I'm just gonna let it dissolve. But then I chew that. Yeah. So then I'll reach for the next Altoid, and I keep breaking these promises to myself until I have 10 Altoids in one sitting. It's a problem, Brandon.
That's why I stick with icebreakers, because they're actually a little harder instead of Altoids, where it's softer to bite on.
Yeah, the icebreaker might chip your tooth or something.
I will say though, actually, so I had a busy day on Thursday or Tuesday, one of those days, where I forgot utensils for my lunch.
Oh shoot!
So I literally had clients going from 7 a.m. up to 1 p.m. So usually I'll eat with one of my 9 a.m. or 10 a.m. I'll eat during his session because he's very chill. But I didn't have any spoons or forks, so I literally just had a box of Altoids that whole session because how hungry I was.
Oh my god!
I had Altoids for lunch that day, dude.
That's terrible.
That really was, dude. That's a sad story.
That's what, 10 calories? And dude,
it was so sad. I was just I literally put I got a handful of it and just put it all in my mouth at one point, and I was just chewing on it, whatever. And I was like, all right, this is pretty cool. This will last me for another few hours.
Oh my gosh! We don't recommend that. Any of our viewers.
That's where it's all about just that's where preparation is success. Let's flip this message. Preparation is success right here. If you know you're gonna meal prep, have a busy day the next day, meal prep and bring utensils.
Hey, make a plan or plan to fail.
Exactly, there it is. And you guys would probably think, damn, this podcast is probably about meal prepping, but it's not.
Or Altoids.
I know, or Altoids, or something nutrition-wise. No, it's not. It's actually about why knee pain, when people have knee pain, guess what? It's probably not coming from the knee itself.
Brandon, you're telling me that I feel the pain here in my knee joint, but the knee joint itself might not be the cause of the pain?
Most likely, no. In a lot of people, yeah. Yeah, and that's just because of the anatomy of the knee. So the knee is right in the middle between your ankle and your hip. I wish I had my skeleton with me right now in my room. All right, we got a live skeleton right here, folks. But yeah, so the knee is right in between the ankle and the hip, right? So hips on top, ankles at the bottom. So there are more muscle. I'll tell you right now, there are more muscles in the hip joint than the knee joint itself. Yeah, you would agree?
Yeah.
And then there are also more muscles down at the ankle joint than the knee joint itself, right? So that means that the hip joint is actually more known to be more mobile, and it's the prime mover, and it sends commands of the whole leg movement down the chain. So if the hip was weak, let's say with bringing the leg out, abduction, which is kind of just think about kicking your leg out. That if the hip can't do that, it just affects the knee itself down the whole line.
Yeah.
Yeah, and then same with the ankle. So the ankle is so close to the ground where it's if you're walking and your ankle's not stable and you're just hitting your foot forcefully with no control because of the ankle, some of the pain will just go straight to your knee. Mm-hmm. Yep. So it's just we like to think of seeing the whole body as a kinetic chain.
Exactly. So I'll say for kind of the most common ones that I see as actually we should talk about the role of what the hip and ankle do first, right?
Yeah.
So obviously you can jump into that.
Yeah. So I feel like we said that, but I'll get into more detail. So
okay.
So the hip. So if we go off to the point where it's the hip has more functions than the knee itself, the hip has more degrees because it's a ball and socket. You're able to go into flexion, bring the leg up, marching. Yeah. You're able to rotate it, going to this motion, if you can see it.
Abduction, going out away from the body.
And then adduction.
Towards the midline of the body.
Yeah. And then you have extension also, so it's kicking back.
Flexion, do we already say that?
Yeah, we said flexion, yeah. So there's a lot stuff we call it degree of freedom that goes on at the hip. But when we talk about the knee, all the knee does, it flexes, which is when you bend your knee, and extends. And it also does small rotations where you internally rotate and then externally rotate. So a lot of people don't really consider those that much, but those are important in terms of how to fully extend the knee and how to fully flex the knee.
Yeah.
Yeah, so those are the only maybe 2, arguably 4 movements that the knee does compared to the hip where I mentioned maybe 6, 7 different movements. So that's why it's really important to look at other aspects of the whole leg when we're talking about knee pain.
Totally.
Yep, and then also the ankle. So the ankle does, like you're stepping on the gas pedal, that's plantar flexion, and then when you bring your toes up,
Dorsiflexion.
Dorsiflexion, yeah. And there's also eversion, where you're kind of bringing the ball of your foot, pointing it in towards your body. That's that's inversion. Then we have eversion, where you're pointing the ball of your foot to the outside.
Which I feel like those mix me up. But anyway, so pretty much you have about 4 functions of the ankle.
Yeah.
What was that? For the hip, you have the flexion, extension. You have
6, about 6, 7.
7?
Yeah. Well, flexion, extension, abduction, adduction, internal rotation, external rotation.
6.
Yeah, 6. 6. Yeah.
So we got 6
yeah.
for the hips. So that's a lot of things, which is like the 2, arguably maybe 4 for the knee, but
I would say it's more 2.
2.
Yeah.
Okay, yeah. So let's start off with the most common. So I'm going to talk about some things that I see with my clients a lot. Why don't you talk about the causes behind that? So number one thing I see that is very common and leads towards knee pain when we talk about the ankle is going to be a lack of ankle mobility as far as allowing that knee to travel forward over the toes during like a squat or something like that. So that would that be plantar flexion?
That would be dorsiflexion.
Dorsiflexion?
Yeah.
So plantar flexion, dorsiflexion. So that would be dorsiflexion. Yeah. And I'd say that's kind of the thing I see the most as far as the ankle goes. You think of like a squat, someone's not able to get down all the way. And if they were able to have that full flexion where their knee is able to travel farther over their toes, less of that load is going to transfer to the knee joint. But in the case that they don't have that ability, the knees can be a lot more impacted. Yeah, that's the most common thing I see.
That is a very common one also that I see as well. When people have like tight ankles and are able to kind of move their toe up, especially with like a squat. So when someone's squatting, you need that motion in your ankle because it kind of sets the muscles up around the whole leg to be in a good position to absorb force or absorb the shock, which is you squatting down. So if your ankle is restricted in that dorsiflexion motion, then it's going to stay in that position. So that means the force is going to travel up and it's going to get the knee itself. So that means the muscles around the knee aren't able to absorb the shock because if we back up here, you always want the active structures of the leg to absorb the shock instead of the passive structures. Active structures meaning the muscles. Passive structures are the joints itself, like the actual the ligaments and sometimes even the bone on bone. But I hate using that word. But yeah, it really is a kind of like bone on bone, put kneecap on the tibia, kneecap on the femur type of thing.
So that's the number one thing I see as far as the actual ankle goes. And I don't know if it's the number one, but this is the most common thing I'm aware of with my clients as far as the hip goes. And that's going to be like a weak glute med, that side muscle that helps to abduct or to take your hip away from your body. That's like probably the most common one I see, but I don't know if that actually is the most common.
Yeah, I would say those two are probably in the top category.
Okay.
We can talk about the hip weakness one, the weak glute med. So the glute med is located right. It's like one of your glute muscles.
It's your side butt.
Side butt.
Your
People call it the side butt. Yeah. So you can see people work it out when you do like lateral band walks. When you see
the hip opener machine.
Yeah, hip opener machines. You can see people doing clams.
Yep.
You can even see people every time they put a band on and do squats and doing bridges, hip thrusts. That's how they're working the glute med or any like type of like single leg stance. So so that causes weakness in the hip, of course, because it's not able to pull that femur out.
Yeah.
And when that femur or that top part of your hip isn't being able to be pulled out to the side, then when you squat or when you walk or whatever, that knee itself is not being in a good position to make contact with the ground to absorb shock when you're squatting. Yeah, you know what I mean? So like I always call the hip as like the one of the controllers of the knee because it's like on the top surface. If we talk about like the hierarchy of like control of the leg, I would put like the hip as like number one because the hip kind of dictates where to put the knee in a certain position.
Totally.
Like walking, running, especially with like a lot of our runners, like they usually have a lot of knee pain because they never really work out their butt as much. It doesn't even have to be a glute med. It could be like the glute max in general, like the whole glute itself.
Yeah, so I feel we probably, for the audience, don't have to go into the details of every other muscle, but why don't we talk about generally the reasons, like each of those could be contributing, like is it weakness, is it tightness, and then why don't we talk about the most common ways that we, as the audience who might have knee pain, can address that.
Yeah, for sure. So we talked about the dorsiflexion already, so that's if you don't have that ankle motion. that's just causing the pain because it's not putting your knee in a good position. Same as if your glutes are weak, it's not putting your your knee in that good position also. And then there's also one where another common reason why people get knee pain, it's actually due to probably coordination. So if I have a client come to me like saying, oh, I have knee pain, then I ask them, okay, when do you get the knee pain? So they'll tell me, for a certain activity. So they'll say running. When they tell me running, the first thing I already know is because of how they run. Because I think we've talked about this in previous episodes where it's like, are you making contact with the front of your foot? Or are you making contact with the back of your foot on the heel? And that just changes the force of how your body absorbs contact. All right? I'm not saying like there's so many studies that argue like is landing on the front of your foot is bad or if landing on the heel is bad. It just really depends if you have certain limitations. So because if your body is already like prone to like that whole front compartment, then landing on your heel might overwork the front compartment, which is that leg, so causing that knee pain. So it really just depends.
Yeah, it depends, right? And I feel like for some of our audience, they'll probably totally get some. Maybe it's going over their heads a little bit right now. But okay, so firstly, I want to briefly ask a question, kind of to indulge my own curiosity, and then let's talk about some practical ways people can address that.
Yeah.
So I worked for a little bit with this trainer. His name, he goes by Simply Knees. His name's Cody Williams. He's great, but he's an ATG coach, so we learn a lot of stuff from knees over toes guy.
I took his program.
Super viral right now, and you took his program. And two of the bigger things I took away that helped me with some knee pain that I was experiencing was, well, first of all, I had some imbalances from side to side, so some hip tightness, which we can talk about weakness versus tightness in a sec. But also I had, when I started to strengthen my tibialis anterior and my VMO, that helped a lot as well. So that would be like with the reverse step-up exercise, or then like those the toe raises everyone's doing right now. That's super trendy. What do you think about those exercises and how they fit into that overall program? And then what do you think about the knees over toes program in general?
Yeah, I actually like their program. Well, of course, my answer is going to be it depends.
Yeah.
But I will tell you right now that I do like I do take some of knees over toes programs with a lot of my clients with knee pain, especially when I know like the pain is coming from like from their hip or lack of ankle dorsiflexion, like stiff ankle. I still do some exercises where it's like you do your toe raisers along the wall, because when you do your toe raisers, essentially you're literally trying to gain that motion that's super stiff in the ankle. So so I like how they do it like that instead of just like trying to stretch the ankle out.
So do you think that is the function, is since you're strengthening the antagonist muscle, the of like here, like that's able to lengthen more. That's kind of the function.
Yeah, I would say it's kind of like you're strengthening the motion that you need.
Okay,
I would say like that. I don't really know what their whole philosophy is between that, but I feel like that's what their intention is, and also because when people have knee pain, it's usually because, like what I said, like not absorbing shock if it's like
they say that muscle helps with deceleration.
Deceleration, yeah. So like I give it to like people like right after surgery. They do a lot of tibial or like toe raisers, like that, and they also do stuff where it's like they're kind of standing and then on single leg, and they do it also single leg toe raisers. That's another variation.
Cool.
For people trying to help with that deceleration.
Yeah.
So I do like that. I also like what are the other ones, like the ATG split squat.
Yeah,
I love that one because a lot of people, when they don't really train.
The ATG split squat is when you're doing like a lunge, but you have
the heel is elevated in the front leg, and then you're trying to bring your knee on that front leg over the toes.
Yes.
Yeah. So I like that one because you're kind of like training how to literally bring your knees over your toes and training that mobility.
Totally.
Yeah, and then the other one they have is like that they made popular is like backwards sled walks.
Oh, yeah. But that's just more tibialis, right?
That's more tibialis.
But what about the reverse step up I was just mentioning?
The reverse step up. Yeah, I like that one too. Actually, for most of my knee clients, I do give them some kind of step up, especially like reverse step up. Like you're talking like the step down, right? Like
for the VMO.
Yeah, for the VMO. Yeah. I have them do that. But what I do with my clients is because I really want to be fine and precise.
Yeah.
Just because I still do believe like the hip weakness is one of their their root causes or their biggest root cause. I put a band, one of those like exercise bands, like those long ones, through their leg, so it pulls their leg to the side.
Band distraction. Cool.
Yeah, band distraction to the side. So when they have to do their step up, I actually make sure that they're pushing away from that band, so it keeps that knee like in a very good position to fire. Keep that VMO in good position to fire. So you can mess around with the bands also to where it's like that you can pull from the side. So.
But let's give our
I know. I was like, oh,
I was just indulging myself. And I feel a little bad.
Like,
we need to give our audience that value. So, guys.
We had a very, that was a very unique conversation we had.
Yeah,
I forgot we were even recording.
I know you did.
I was like, oh shit.
We got to bring it back.
I know.
So what are some things you would tell the audience? You know, when, like, if they experience knee pain initially, should they seek out physical therapy initially?
Yeah.
Or are there some other steps, like things they could do that would probably help? What do you recommend?
So, of course, the gold standard is always going to be, like, go get a consulted with a physical therapist, just because they'll be able to, physical therapists, they'll be able to, like, look at your body, look at your activity level, conditioning, and tell you, like, what you need and what you don't need. Like, because you don't want to go into a plan to where it's like you might be doing, like, you know, a knees over toes program, or you might be strengthening the glutes, whatever, when maybe that's not what you need. Maybe you just need to, like, work on your single leg balance is a big one. Single leg balance. Maybe you'll need to work on your hamstring strength. Maybe you'll need to work just on how you run. So maybe it might be those issues, and I'm pretty sure you don't want your time wasted where let's say you suck at, like, single leg balance. So but for 3 months you're on a program to where you're just going to go ahead and do some, like, backward sled walks, or, like, those reverse step-ups. Because you still want to seek yourself out to a physical therapist, just because, you know, save time and actually find the root cause. So that's my gold standard. But if you want to really assess yourself, there are some assessments where you can kind of check your ankle dorsiflexion, the ankle motion. We'll put some links up from YouTube videos on the description. You know, I'll definitely do that.
Okay.
Yeah, so you can check your ankle dorsiflexion on a test, just to see how far your ankles go, and then you'll be able to actually tell if it causes knee pain if one ankle is stiffer than the other, and the ankle that's stiffer has the knee pain. So
ankle dorsiflexion, again, that's if you're bending your toes towards your knee.
Yeah, towards your knee.
And you're saying to do that on each foot.
On a wall,
and if one of them is less or more than the other, then that restricted one, if it has pain, you should probably work on your
ankle dorsiflexion, yeah.
Which, by doing that, you know, you could be stretching, you know, like the soleus and the gastroc.
Yep.
And then also doing those toe lifts like we just talked about. That would be a good combination that you would recommend?
That would be a good combination I recommend. Also, if you look up, like, ankle banded distraction, you could do it with a band. It's where, I'll try to describe this, but it's where you put a band in front of your foot, and it's hooked on to, like, behind you. Yeah. And you're kind of, like, in a position, like a half kneeling position, where you're on one knee, and you're just kind of, like, stretching that ankle. So what it's doing is you're basically, ankle dorsiflexion, it's basically one bone on top of another, and the other bone's kind of, like, the other bone under it is sliding back, and you're kind of bringing it up. So it's a joint mobilization. Cool. So those are 2 ways to do it. Yep. And another way you could kind of assess yourself back at home is to see, why don't you go do some lateral band walk. This is just like a quick assessment right here. Do some lateral band walks with, like, an easy band. That's where you put a band above the knee, you put it on, like, pants, and then you just do side steps. If you feel like it's very exhausting towards one side than the other, then your glute med is probably really weak, and you need to work on it.
And you definitely have an imbalance.
Yeah, you definitely have an imbalance there, especially if, like, you're going towards one side, and that's the side of the knee pain. Yeah, that shows a lot. Like, gotcha. When a lot of imbalances are happening on the side that you're complaining about for pain, you know, then that's, like, a big indicator. You know what I mean? Yep. And another one is, like, this one's a little tough to diagnose for yourself, but we'll just call it, like, a little assessment where you kind of relax your leg, and you just, like, play around your kneecap. If this is, like, pretty common for a lot of people who are, like, hypermobile, if they're able to bring their kneecap all the way to the side of their knee and even to the other side, that does show that they're, like, hypermobile. So that's that hypermobility term. So if you have pain, and if you actually have pain on that side, then that does mean your knee is, I hate to use the word unstable, but you do need some stability for that knee.
Yeah, why do you hate to use that word?
Because, like, instability, that just, like, that's a red flag word for a lot of, like, patients and clients, where they're like, oh, I'm unstable, oh no.
Okay, you know, it triggers a lot of, like, things. Gotcha.
I hate using that word, but it's just, like, I should say, like, you need more strengthening. Yeah, because the reason why your kneecap is, like, moving so much is because your quads aren't able to, like, hold that knee in place. So just imagine, like, when you're squatting and you're, like, running, lunging, whatever, walking, that kneecap is just moving side to side, and it's just, like, bumping into, like, all the structures there. You know what I mean? That keeps happening for, like, 30 years, 40 years. you may have bigger issues.
So then, tips for preventing knee pain. What are some tips for that?
So after assessing that, tips for preventing knee pain. The question is, it depends. I'm just kidding. So tips for preventing knee pain is you want to make sure that you're doing if you're like a new exerciser, you want to make sure you're working out. When you go into like a new exercise, you want to do it with tempo. I would say like as you go down for a squat example, go down at a 5-second descent, hold that for 3 seconds, and then come up. Just do 5 reps of those. So that's a big one that I give to a lot of my clients for the first time squatting, just because you're able to like let the body calibrate and be efficient and get familiar with the movement itself.
Yeah.
And actually activate the right muscles. Yeah.
Okay.
So that's one. Go work out with tempo. Then the other tip I would say is probably definitely manage your load for sure. Like don't
not going crazy heavy everywhere.
Yeah. Like don't do like 2 plates, 3 plates. Like like after hitting 225 for like 10 reps, don't add on another plate the next day. You know what I mean?
Sure.
Yeah. So I would say start off if you're into like a new leg routine. Do like go from like once a week, go right into like 2 times a week after 3 weeks maybe. So progressive overload is my second tip.
Cool.
Yep. And the third one is probably work on that damn mobility.
Work on your mobility, guys. All right, so you heard it. That's really the biggest factor is going to be the mobility. Do you have the requisite mobility in your hip, in your ankle? If you realize, like, wow, I can bear, like, when I do a lunge or something with hip extension, I feel so tight, or like I just can't get down all the way in a squat, you definitely need to work on your hip mobility. If what happens where we said you can't lift your toe all the way up, or you feel that restriction with the knee trying to travel over the toe during dorsiflexion, you got to work on that, because if you're experiencing knee pain and you have a limitation there, it's probably related.
Oh yeah,
it is related.
It is related. I will say it is related. Yeah, it's crazy how like the body works. Where a lot of people don't even aren't really aware of that. Like a lot of my newer clients coming to me for like knee pain, they're like wondering like, why am I strengthening my butt so much? Yeah. And then it's hard to kind of tell them after like one session like, oh, it's all related to where it's like, I have a skeleton, at my office now, so it's like it's kind of easier for them to visualize it, but they're still not like sold to where it's like that's where it's coming from, not just like from the knee itself. They expect me to like give them like leg extensions and just like lunges, all day, but we really got to do like a lot of hip thrusts and some mobility with the hips. Like so, hip 90-90s is a good one also to add.
I love hip 90-90s.
Yep,
definitely.
I've shown you those.
I use them with all my clients now. They're amazing.
Exactly.
Brandon, anything else that we should add, or any points you just want to note for the audience before we wrap this episode up?
I will say definitely take care of your knees, just because I do work with a lot of post-total knee replacement clients, and they're not liking the process after. But after they work with me, they do like it. But the process of like coming home after a surgery or even getting the surgery, that shit sucks. But yeah, take care of your knees.
And if you need a physical therapist and you're in San Diego, I mean, I don't know, who should you go to? There's so many physical therapists.
I think there's a guy named Pascual Performance.
Oh, okay.
Yeah, he's in the Marina area, Marina Boulevard. Right?
Okay, all right, so but anyway, thank you so much for listening to the episode. If you have any more follow-up questions about this, I know some of the stuff was kind of in-depth. Feel free to leave a comment. Brandon or me will definitely answer the question. And other than that, we'll see you all in the next episode. Peace.
Later.